Hello, my name is Helena Bennett, and today I am speaking about the ethical differences between withholding or withdrawing nutrition support from a patient with PVS versus a person with advanced dementia who can no longer consume foods orally. When we consider providing nutritional support to a patient with advanced dementia, we should reflect upon the ethical principle of non-maleficence, which states that we have an obligation as practitioners not to inflict harm on others. In this case, providing nutritional support would cause more harm than benefit. Advanced dementia is considered terminal, and nutrition therapy, due to its futility, would be considered more harmful than beneficial. Research has shown that there is no significant benefit from providing nutritional support to patients with advanced dementia regarding nutritional status, chance of survival, or improved healing. It may cause adverse effects such as aspiration, pneumonia, and ulcers. The patient's cognitive status is significantly impaired at this stage, so obtaining advance directives in the beginning stages of the diagnosis is favorable. The Aspen guidelines do not recommend nutrition therapy for patients with terminal advanced stage dementia. Still, the patient and their families should be approached with great compassion and concern for the patient's wishes. In a controlled randomized trial, advanced care planning was associated with an increased proportion of those who requested not to use feeding tubes. The ethical principle of beneficence should be practiced because the interdisciplinary team of doctors, nurses, and registered dietitians must be able to decide for the patient to withdraw from nutrition therapy if the patient is unable to do so and the therapy will cause harm to the patient. The team should still advocate for the best decision for the patient. We have different ethical evaluations to consider regarding patients with PVS compared to patients with advanced dementia. It is essential to assess if providing nutritional support could be beneficial, potentially increasing the chance of survival or improving quality of life. Patients who are not terminal, who have cancer or brain injuries, who are in PVS could potentially benefit from nutritional support. Ethical considerations must be made by the interdisciplinary team of doctors, nurses, registered dietitians, and the family, who must determine if the patient has reached end-of-life care. The ethical principle of justice should be practiced in deciding whether nutritional support is needed and if the effort would be ordinary or extraordinary. The family members may feel like everything must be done to keep their terminal family member alive, or be unsure of what their family member would wish, so they need careful guidance from the medical team to help make the best decision for the patient. The ethical principle of autonomy should be practiced by being mindful of the patient's religious beliefs and culture and incorporating the patient's wishes regarding withdrawing artificial nutrition therapy. Often the decision to start or withdraw artificial nutrition therapy is left up to the family along with the guidance of the medical team. As dietitians, it would be our ethical duty to provide informative and compassionate nutrition decision support as part of a team of doctors and nurses that would best benefit the patient. The families of patients with advanced dementia without the ability to eat should be informed that the artificial nutrition therapy would be more detrimental than beneficial, that their condition is terminal, and that artificially feeding the patient would only prolong the inevitable. The family of PVS patients would have to consider whether the family member would want to be kept alive short term after a debilitating event. The patient would need to be evaluated to determine if they could recover. Cultural values, religious beliefs, and the patient's preferences must be considered when providing compassionate guidance. Ethically, we must determine if patients with PVS have an uncertain prognosis, and if they do, whether nutrition support will benefit or harm them. Unfortunately, patients with advanced dementia who have lost the ability to swallow food would not benefit from nutrition therapy. Advance directives from the patient would be beneficial because the patient's autonomy would be respected and the family and medical staff could make easier decisions.